I think waking up knowing that my access is fully accessible when I go to dialysis and not having to constantly check it and worry that I'm gonna have to go to the hospital. That's a big worry.
When the doctor said that this fistula first one is not work, and that day I cried the whole day.
Access-related complications are probably the #2 cause of morbidity and mortality and hospitalizations for dialysis patients. At all costs, you want to avoid a catheter because there's a higher rate of infection and there's perhaps also a higher rate of an inflammatory state with results in poor outcomes for the patients, more hospitalizations, higher mortality.
There's absolutely no question that fistulas require the least maintenance, actually are the least expensive to put in and maintain long-term, and are the safest access for all patients.
If you were able to, through technology, through different types of interventions, actually show that you could increase the maturation rate of fistulas, so people who were borderline for a fistula placement, now you're pretty sure that they'll get a good fistula with one operation or maybe 2 operations, then it's a home run.
If you can mitigate that failure rate and really go in the vast majority of cases to a radiocephalic anastomosis, that should do well by the patients.
Having a fistula that would last longer, where you wouldn't have to go and get it cleaned or checked or have it narrowing as often, that would make dialysis so much easier.